Good afternoon and thanks for joining us for Living Local, your lifestyle show for everything Charleston. I'm Ashley Meservey. It's Medical Monday here at East Cooper Medical Center, and today we're talking about endometriosis, which impacts thousands of women each and every year.
Medical Monday, sponsored by East Cooper Medical Center.
Today we're at East Cooper OB/GYN, and joining me right now is Dr. Christi Cook. Thanks for being here with me today.
You're welcome.
The office is fantastic, by the way.
Thank you.
Very well decorated. Okay, so first of all, today we're talking about endometriosis. We see it on TV all the time, but what is it exactly?
Well, it's a chronic pelvic pain condition. It affects about 10% of women of reproductive age, so average between 25 and 35 years of age. And basically what happens is that the lining of the uterus, called the endometrium, implants outside the uterus where it's really not supposed to be. And it can implant along the ovary, along ligaments that sort of hold the uterus in place, along the bladder, along the bowel, along the fallopian tube. And then when women have their period, it swells. And so this can cause pretty significant pain and sometimes lead to some infertility.
That much more uncomfortable.
It does. These women typically have severe pain impacting their daily life, so a lot of them will miss work as a result. A lot of the younger girls may miss school as a result of it. They also can have a lot of pain with intercourse, so that impacts their personal life as well. And about 50% of these women can have infertility issues.
Wow, okay. Well, how is it diagnosed?
Well, certainly if women are having any of these symptoms, we want them to come into our office and we take a good, thorough history. Sometimes it can run in families as well, so a good family history too. We do a good physical exam. Sometimes there can be clues on our physical exam that will sort of lead us in that direction. And we also use ultrasound as well. These women can have large ovarian cysts called chocolate cysts or endometriomas that are associated with endometriosis. So sometimes we can find them on imaging. However, most of the time it does require a biopsy for a proven diagnosis, and that would require a woman to undergo what's called a laparoscopy, which is an outpatient procedure.
Talk about some of the symptoms as far as if people are wondering, oh, I'm just having a bad period and it's just, you know, I'm just in pain.
Well, typically these women, if their pain is not controlled with over-the-counter medications, that
like
can certainly, exactly,
like
and Aleve and ibuprofen and Motrin, that kind of thing. Certainly if it's debilitating, it's impacting their daily life, they can't function, they can't take care of their children, they can't go to work, they can't go to school, then those are things that lead us to believe that it may be more than just regular menstrual cramps.
So if you let it go and you're kind of just, I know me, a lot of times I'm just like, oh, I'll be all right, I don't need to worry about it. I always say buck up. But so if you wait too long, can it turn into something much worse?
Well, it's not a precancerous condition, but certainly the symptoms may worsen over time, again, impacting their life a lot more, and certainly could lead to some infertility issues.
And when you're talking about infertility, what type of infertility? Just making it more difficult to conceive?
Right. Well, it is. Certainly these implants can scar the tissues in the pelvis like the fallopian tube, and so it makes these women much more difficult. It can distort the anatomy of the pelvis, again, making pregnancy a lot more difficult. Fortunately, though, we can use surgeries to help with that, and also we can use reproductive assisted technology to help us.
Isn't it amazing how much it's progressed over the years?
It is. It is.
So where should we go for more information about this?
Well, certainly if women are having these type symptoms, I encourage them either to come see us at our office or certainly see their own obstetrician gynecologist and see if we can't help them.
For more information, you can always visit East Cooper Medical Center online at eastcoopermedctr.com.